Welcome to UT Southwestern's What to Know. Getting accepted to medical school, law school, or graduate school amid the pandemic comes with added curveballs. With student research opportunities, internships, and in-person interviews in flux, how's a student to stand out? Here today to answer these questions and more are Dr. Shawna Nesbitt, Associate Dean for Student Affairs at UT Southwestern Medical School, and Pamela McNulty, Director of Pre-Health Advising at Southern Methodist University. Thank you both for joining us. Dr. Nesbitt, traditionally when someone applies to medical school, we look at a variety of things. You look at their entrance exam scores, you look at grades, you look at volunteer work they've done, you've looked at any summer research or other research that they've done. What's your evaluation of a potential medical student look like in the COVID era?
We really look for to make sure that everybody has equal opportunity and access. We're looking for the characteristics that define someone who is really prepared. And so this goes back to, how do you interpret what's happening right now? I think in applications, defining what your own experience is of COVID and how that has affected you will tell us a lot about your maturity, about your understanding of public health, and how becoming a physician really is one of the most important things that we can do right now. I mean, the need for physicians is even greater than it ever was. But I think taking this opportunity to really speak to that on a personal level in the application supplants some of the other things that they may not necessarily be able to do.
Pam, for students who are beginning the process of applying and interviewing for medical school this year. Obviously, it's going to be a very different year than what they envisioned last year as they were thinking about this. What advice are you giving them in terms of prepping for interviews for medical school?
The best advice I can give them to prepare for interviews is, yes, COVID happened, but how did you handle it? How did you cope with it? And another thing that I talk to them about being prepared for interviews is you're not going to get the opportunity to probably visit these campuses in a face-to-face fashion the way you have been able to in the past. So be intentional when you are doing your research about programs, about the cities that they're located in, about the populations that they work with, and really take a deep dive into your application to see how you fit with that school.
Dr. Nesbitt, interviews have always played a big role in the medical school application and acceptance process. How are you adapting your processes, and what should a student expect when they come to interview at UT Southwestern?
We have decided to interview all of our students remotely. Each student will have 2 interviews, and this will allow us, again, to make sure that everybody has the equal opportunity. So whether you live in Dallas or whether you live across the country, you'll have equal access to the same level of interviewing. And we may find that it stays beyond this interview cycle for many reasons, one of which is that it's far less expensive for students. The cost and the time away from college may be exorbitant for them. So being able to interview remotely actually increases access to other populations that are not necessarily as financially prepared to handle that cost.
I appreciate very much that perspective that by decreasing the financial burden on students, it should promote diversity and allow us to perhaps see a broader swath of students that are interested in medicine across the United States. Pam, are you hearing that from students too? Some optimism around being able to interview at more places because more virtual interviews might just mean more interviews, period?
Absolutely. I've actually seen students who have struggled with the ability, even in spite of having a really great MCAT score, excellent GPA, having that access to be able to travel to a New York or to a California. So I'm excited that Dr. Nesbitt, and I'm hoping that other medical schools will look at this as an opportunity for students to have equal access, when in the past, I know for sure, we've had students who've not had that ability.
Dr. Nesbitt, we've heard a few times from potential students that they're concerned that the experience that they have as a medical student might be diminished or changed in a negative way by the COVID pandemic. What would you say to those concerns or questions?
First, I would say that you should understand that medicine is an evolving field. What we are prepared to do is to handle challenge, to handle the uncertainty of what will happen at any moment. rather than it be a negative, this is an opportunity. It is an opportunity to learn firsthand how to manage a difficult time. And in medical school in the 80s and 90s, we remember, what happened when HIV was the most prominent epidemic, and how did that affect us? I will never forget those experiences, and how they changed my perspective about taking care of patients. I expect nothing less about the COVID-19 experience. And so they will be learning how to manage things very quickly, how to adapt, and there will be new processes from this whole experience for all of us that we're going to emerge with.
Pam, I have a daughter who's a third-year student at SMU, and so one question her friends are asking that are interested in medicine is, should they take a gap year and just wait out the COVID pandemic? What do you say to that question?
If you're taking a gap year to avoid the disruptions in COVID, I don't think that's a good plan. This time that we're living in is a perfect opportunity for students to really show that they're resilient, to show that they're adaptable, to show that they really want medicine. They want to get out there on the front line. Some of my students have actually said that COVID has really highlighted for them that this is really what they want to do. So for those students who are still passionate about it, who have an application that shows that they are mature, that they're compassionate, they're empathetic, those are students that I would say go for it. But for the students who might otherwise take a gap year because it's going to help them grow and develop, they're the ones that I would say be open to considering it.
Dr. Nesbitt, what are the 3 things a prospective medical student should be thinking about?
Ask yourself 3 questions. Why? Why do you want to do this? And your why should be a very clear and personal reason for the reason that you'd like to become a physician. It should be more than just, I think I want to help people. There are lots of ways to help people. Why medicine? The next question is how. And the question really gets to the extent of looking at the details of what it requires to become a physician. What do you need to have? And is your backpack full with those particular skill sets that you need to have? And if not, then go get them. And then the when. Timing is everything. And timing, medical school doesn't run away from you. We'll be here. But if you are ready, we want you now. If you are not ready, then look for the proper timing and prepare yourself.
Pam, what are the 3 things a prospective professional school student should be thinking about right now?
Assess your GPA. Be honest with yourself. Do you have the academic credentials that will make you competitive? Number 2 would be, think about the skill set. As you're going into some of these different professional programs, you have to have a certain skill set that comes with experiences. Do you have the experiences that you need that demonstrate that you are competitive and ready to enter that field? And then the third, I think, are you emotionally ready to start professional programs? It's not just about graduating from undergraduate and then starting that job. It's about having the emotional maturity to handle all of the adult responsibilities that go with becoming a professional. Are you ready to handle those? So I think if you have the GPA, the skill set combined with the experiences, and you have the emotional maturity to handle and move into a professional environment, then you're pretty ready to move on to the next level.
Thank you both for joining us today and for the excellent advice that you provided to prospective students and to their families.
Thank you for the opportunity.
This was fantastic.
Thanks again for joining us, and until next time, stay safe and stay healthy.